Okay, great. So first, I want to talk about the paper selection. So I've have a list of papers already, which I also mentioned in the last lecture. So there are 35 papers which you will select one of them for your paper presentation during the course. So they were categorized in different topics, right? So you can see here segmentation, maybe here the medical image processing, right? Under each category, there is a couple of papers. So if you are interested in a particular topic, say you are interested in segmentation, you can go here and maybe pick one of them for the presentation. Okay, so you don't have to, you don't have to select the papers from here, just one topic. You can browse other topics if you're interested. So the reason I have different topic is that so this will have cover a diverse topic when you guys are doing the presentation. So everyone is able to learn knowledge from different topics. Okay, but so now we have a total of 19 students. So I think that probably is going to be the final roster for this class. So you have enough choice to select one from them. But the paper selection is based on first come, first serve. If some of the paper you're also interested, but it's already being selected by other student, you have to find another one. Okay. So I will release this after this course. So now you can focus on the course lecture. You don't have to worry about, check out the papers. So if you decided, which papers you want to, present, I have a sign-up sheet right here. So you will click this sign-up sheet link. It will have, list the ID and paper titles. So what it will do is, put your name here, like, if you decide to select papers number 6, okay, you just put your name here. So I know you are going to select this paper for presentation. Okay, so here you will also see what papers are still available, right, which haven't claimed by other students. Once you figure out which one you want to present, here is the presentation date. So we have a total 19 students. So I'm going to have 10 classes for the presentation. So each class will have, basically 2 presentations or 2 talks, right? So maybe each 20 minutes we'll follow up with questions in a Q&A. So then we go to the next presentation and we'll do the Q&A as well. Okay, so each class will have 2 slots. So, based on your schedule, how comfortable you are, or maybe how familiar you are with the paper, you can select which date you want to present, okay? And also, since we already kind of finalized the course, roster, we know 19 students, then I can finally kind of scheduling like what will be the future lectures look like. Okay, so in the next maybe 8 or 10, you can count here, lectures, I will basically cover different topics for the deep learning and medical image computing. Okay, so once we finish all these lectures, so pretty much I will cover all the the topics which you will see in the paper. Okay, so at this point you will be comfortable, maybe has some enough background knowledge, so you are able to read the papers and presenting some of your ideas. Okay, and so starting from March 1st, we will do the presentation. So there is going to be a total of 10 presentations. Okay, and then the rest will be the final project presentation. We may have like 1 extra lectures here, or maybe later I'll maybe discuss with you guys, would you rather have a break, right? Because you did all the presentations, maybe you need some time to focus on your final project, right? And, prepare the presentation. So, but we can discuss that. Okay, so, but pretty much this is gonna be the schedules for future classes, okay? So finish these different topics, then we go to the paper presentation, then we go to the final project presentation, okay? Any questions?
Yeah, where is this located in the web course? I can't find it.
Yeah, you mean the papers, right?
Yeah, this.
Yeah, I haven't released it yet. I'm
Oh,
going
okay.
to release this after this course because I don't want you guys, if I release now, then maybe you guys can look at those papers and, but right now I just don't have to, don't have to worry about this, just focus on the lecture content. After that, I will send an announcement and give you some detailed instruction, and you can go there, check the paper and make your selection. Okay, you have enough time to make a selection. I think the deadline is January 27th. So you have enough time to go through these papers, browse their, titles, maybe abstract, and figure out which one you want to choose. Okay. Okay. All right. Any other questions about the presentation? Okay. By the way, there's another student asked me like this first come first serve. So this is just for the paper selection, not for the final project ideas. Okay. So I provide a list of project idea, like 5 or 6 ideas. So, if you're interested, multiple people can interest or work on like the same topic. If you're also interested in these BRADS, which is brain tumor segmentation, you can work on it. If another student is interested, he or she can work on it as well. Okay. But this is going to be individual project, not working as a group, but the topic can be the same or similar. Okay, you don't have to, select a different one. But of course, I would prefer you, maybe think about other project ideas, maybe relevant to your research, or maybe something, topics you read from the papers. Okay. Okay. Okay, all right. So for today's lecture, we're gonna do a quick introduction to medical image computing. So this is gonna be part 1. So what is medical imaging? Basically, medical imaging is used to produce images of organs and tissues within the body for using in diagnosis and treatment, right? You see the radiologist order a CT scan, right? They will look at your CT scans or maybe MRI scans to, figure out what's the, issue or problems, right? And maybe can prescribe a specific treatment, okay? And different types of medical imagings are used for seeing different things within the body, okay? We'll talk about later, what kind of different modalities of these medical imagings. But why is medical imaging important, right? So it allows doctors or physicians to find disease in the early stage, right? Because you want to, identify those disease or issues as early as possible, right? So you can, have immediate treatment that could lead to better outcome for patients. And also can assist in decisions regarding treatment and future care of the issue, right? So it is so important. Then there's a branch of medicine that is called radiology, right? That is use imaging techniques to diagnose and treat diseases. Okay, so so one thing I want to make it clear is that we are not going to this course is not going to teach you like how to diagnose those based on those medical images and make prescribed treatment. So that's a totally different discipline, which is for radiology. Okay, for this course, we'll just basically using AI technique, right, to do image processing, which may help radiologists, right, to make, alleviate some of their burdens, right? Maybe radiologists have to look at those scans or images, a lot of images on a daily basis, right? Because they have a lot of experience, expertise. They're able to make treatment decisions. But if we are able to using algorithm to come up with AI algorithm, method is able to help them to quickly make those decisions or accurate decisions that could alleviate a lot of their burden. So that's what this course about. Okay. So before we dive into different medical imaging modalities, I want to see, what different modalities, imaging modalities do you know? Any ideas?
MRI is one.
Like X-rays and something.
Yeah, I hear X-ray, MRI. Yes, those are very common imaging modalities, right? You'll see, those physicians will order this kind of image scans. What else? Yeah, X-ray, ultrasound, CTs, right?
PET scan.
Yes, exactly. So here I'll just list a couple of very common ones, right? CT stand for computer tomography. MRI is magnetic resonance imaging, and also ultrasound imaging using sound wave. X-ray, right? That's also very common, and also nuclear medicine imaging, right? So have this postrum emission tomography, PET. Also maybe as PET, right? Single photon emission tomography. Okay, so those are the fall into this nuclear medicine imaging. So the basic concept for this medical imaging system is, for this system, imaging system, it will have some emitting some radiations, right? The energy source, okay? And these energy source may absorb, right? Or maybe the body also emitting some of the energy source that is going to be detected by the detector of the imaging system. So these detectors then will using some algorithms to reconstruct image. So that's the very basic concept how this imaging system works. So there's a couple of requirement for these medical imaging systems. So first is the diagnostic contrast, right? So for images, we are talking about like for those pixel values, we want to have some contrast. So you're able to see maybe different tissues, right? Different organs of the body. And also has to be, has some sensitivities, right? So you are able to, some of the disease or some of the maybe tumors is able to captured by those or reflected on those images. And also not just sensitivity, but also specificity, right? So are you able to, based on those images or regions, able to identify what kind of disease or maybe tumor that is, okay? Obviously function and also the spatial and the temporal resolution, right? So we want to have high spatial resolution, and sometimes we want to have high temporal resolution. So we are able to see the, what's going on, internally, or maybe in terms of anatomical structure, okay? Also, the medical imaging system has to be safe, right? We don't want to, after the imaging scan, then there's going to be causing some damage to the patient. So, so we want a safety. Also, we want the imaging system going to be fast, right? You don't want patients spend like hours on those imaging devices, right? That's going to be a painful process. Okay. Also inexpensive, right? So you don't also want to the system like cost a lot, then maybe some of the patient may not able to afford take some of these medical imaging. and also easy to use, right? So this will maybe helpful for the nurse or maybe radiologist. Just have to maybe make a couple of clicks, right? You're able to generate those imaging scans. Okay. But not a single modality may satisfy these all. So oftentimes we have to using several imaging modalities to make some diagnosis, right? Maybe CT or MRI to make accurate diagnosis. Here are these some of the engineering advances for different imaging modalities, right? So this is the first X-ray in 1895. And this is the X-ray today. So you can see, obviously it's more crisp, more clear, right? You can see the different these bone structures. And on the left is the early CT scan, right, in 1975. And CT today is also more clear, right? You can see these soft tissues of the human brain. Also ultrasound, right, in the early years. So these ultrasound, which it's really difficult to see, so this is the fetus ultrasound. So it's really difficult to identify maybe different body parts of the fetus, right? But now we're able to using ultrasound, right, to determine in the early stage to determine the gender of the fetus, and maybe also and measure like how like the head circumference, bone lengths, right, to measure all these with very clear picture. And also this is the early MRI again. You can see this is very coarse. You are not able to clearly see different tissues or organs, but for today, this MRI is very clear, right? Okay, now we're going to have a very brief introduction to the imaging modalities. So before we talk about some of the details, here I want to present this electromagnetic spectrum. So for different imaging devices or modalities, so the radiation travels in wavelengths, right? Different travels in wave. So different wavelengths will have different imaging modalities, right? So we have this MRI, endoscopy, radiography, or CT, and we also have nuclear imaging, right? So these are their different wavelengths or range of the wavelengths. So for example, for the radio wave, right, which very common. So we all listened to radios before. So the wavelength is pretty long. So which means the frequency is low, right? So the wavelengths can maybe span like a football field, okay? And a shorter wavelengths, we have microwave, right? So we, in the household, we all have microwaves. It has shorter wavelengths. And then the shorter one, even shorter one is the infrared light. And then we have these visible light, right? So from the visible light spectrum, we have the red has the longest wavelengths, which is 700 nanometers. And we also have the shortest, which is the violet, 400 nanometers. And if we go shorter, right, up on the right, they will have this ultraviolet light, okay? So if you're exposed, if you go to the beach, exposed to the sun for a long time, you can easily get sunburn, right? So that's the effect of these shorter or high frequency wavelengths, causing the heat. Okay, so going further here, we have this X-ray, right? So it become more shorter wavelengths, high frequency. And also we have this nuclear imaging, right? Using these, so some of the, for example, this PET scan, we're using radioactive drugs, which we'll call tracer. Well, the detector will detect the emission from these kind of radioactive drugs. So they will generate the image, okay? So the image will show reveal some of the metabolic or biochemical functions of the tissue and organs, okay? Okay, so the first published medical imaging was a radiograph of the hand of the German physicist Roentgen's wife in 1985. So he later, he was discovered the X-ray, and he later won the Nobel Prize in physics in 1901. So he was, experimenting with cathode tubes. He realized that the tubes was emitting not only light, but also a new kind of radiation. So because this is like a unknown radiation, so he called this X-ray. Okay. So this is like the first X-ray of his wife. So you can see this picture shows the hand, right, the bone structure, and here maybe this is the ring. And the X-ray use a very small dose of ionized radiation to produce the picture of the body's internal structure. Okay, so as the photons from the X-ray pass through your body, each tissue's atom absorbs reactive photons differently. Okay, so that's basically the X-ray imaging working principle. So the soft tissue in your body are composed of small atoms, so they don't absorb X-ray well due to photons' high energy. But on the other hand, the calcium atoms of your bones are much larger, so they do absorb the X-ray photons. So that results in a different view on the X-ray image. So in other words, your dense bone absorb much of the radiation, while the soft tissues, for example, muscles, fat, and organs, maybe allow more of the X-ray to pass through them. So as a result, bones appear white on the X-ray, soft tissues shows up in the shades of gray, and air appears black. Okay, so that's why you'll see those kind of gray and white regions upshowing the X-ray. And this shows the X-ray imaging device. By the way, how many of you guys take X-ray before? I'm sure most of them, more or less taken once or maybe twice, right? Yeah. So yeah, I remember I maybe take 2 or 3 times of X-ray, mostly chest X-ray. So this on the left, this figure shows this X-ray machine. A patient can either maybe stand in front of this machine or maybe lie on this table, right, to take maybe chest or maybe the whole body X-ray. Okay, so if for example, if you take the chest ray, at least when I was taking the chest X-ray, I was just standing in front of this machine, put a chest against these, the X-ray generator, right? So then on the back, there's a wall, right? This is called the wall bucky. So it will contain this X-ray detector, right? Capture, the X-ray pass through your body, right? So it can make an image, okay? If you lie on the table, then this X-ray detector or receptor maybe will put underneath this table, okay? So X-ray are the oldest and most frequently used form for medical imaging. They are often used to help diagnose, fractured bones, and maybe also, looking for injuries or infections, and to locate maybe foreign objects in soft tissues. Some X-ray exam may use iodine-based contrast material to help improve the visibility of specific.
Did I call it a camera?
Okay, is there a question? Okay. Yeah, that's fine. So yeah, so sometimes, you know, before you taking the X-ray exam, so, you know, the patient may ask to take some iodine-based contrast material, right, just to improve the visibility of specific organs or blood vessels or tissues. Okay, so there's a various use of X-rays, right? Maybe the dentist will use X-ray to do some dental examination, right? So this here. So maybe they can locate like a cavities of the tooth, right? I think what would be interesting project would be, you know, using maybe machine learning, a deep learning algorithm, you know, to segment individual tooths, right? And also potentially identify the cavity using deep learning algorithm. So that's some could be an interesting project. Okay. And can also be used for surgical markers prior to invasive procedures, right? So, you know, maybe for some of the like orthopedics, right, you maybe have to do some operations there. Maybe you can put some surgical markers, right, to which point you want to make invasion. And also mammography, so which is the X-ray for the human breast. And also chest examination, right, to you know, to detect like a tuberculosis. And also this X-ray can be used for age estimation, right? Maybe examining the age of the bone, right, for forensic purpose. I wonder if, you know, paleontologists, they were also using this kind of X-ray, right, to do some fossils, or maybe like in Egypt, if you discover a mummy, if you want to, you know, go through this X-ray and to figure out, you know, the age, right? Maybe they're using more advanced or maybe specific technique like carbon dating or something. Yeah. Okay, so for the clinical examples, right, we can using X-ray to, you know, check different, you know, bones, right, to see if there's any fracture of the bone, right. So this is very common use, and it can easily be detected, right, if you have a, you know, fracture in a specific bone. And we can also, you know, detect some of the lung disease. Okay, so here radiologists will try to, you know, search abnormal patterns in the chest X-ray, right? Often, you know, the radiologist will report some of the findings as follows, right? The size, dimension, or volume. So for some of the abnormal regions, right? And also what kind of pattern it is, right? Maybe you detect some high density, small high density regions, right? Distributed in a specific pattern, right? Maybe circle or a line or whatever. So you want to describe that pattern, and also the location and how it is interact with nearby structures. Okay, and also the intensity, distribution, shape, etc. Okay, but there's some difficulties for, you know, search for this abnormal patterns used in this chest X-rays. Couple of reasons such as noise, right? So we may have some noise during the imaging process, right? Maybe the hardware are caused by the hardware, or maybe caused by, you know, patient movement, right? And also the vessels can be seen as small nodules, right? So, you know, these small nodules may be mistakenly identified as vessels or vice versa, okay? And also, it is possible that radiologists may miss some of the patterns, right? Patterns may not be diagnostic, right? So you are not able to, based on the patterns, to make some diagnosis, right? And you know, sometimes X-ray is not enough, okay, to make a more informative or you know, more accurate diagnosis. You know, the radiologist may have to order additional other modality scans like CT or maybe even MRI scans to, you know, to make a better judgment. Okay, and oftentimes the, you know, the size of the estimation is done manually in 2D, right? So you have to manually maybe crop out this region and calculate, if this is lung, you have to calculate what is the total volume of the lung, and also calculate this maybe potential tumor or problematic regions. What's the volume or the size of that? So that also cause some difficulties, right? But for this course, we can develop, computer algorithm or maybe AI algorithm that is able to solve or maybe simplify these problems for improved healthcare, right? Okay, so this is another example for X-ray imaging. So this is the mammograph. So the radiologist will look for areas of white, high density tissue and note the size, shape, and edges, right? A tumor will show up as a focused white area on the mammograph. So here in the left, so this is the breast X-ray, right? So on the left, this is the benign case, right? So here, it's not very high dense, right? So this is called considered benign, so which is non-cancerous case. On the right, we do see this is an area or right region, right? High density tissues. So this may be malignant, okay? So which is cancerous. So is there any other use cases, for X-ray you can think of? Or even maybe not
in
just
things
medical.
like, well, I guess like a TSA checkout, right, at the
Mhm.
airport.
Mhm.
Would use anything where you're trying to see what's inside something.
Mhm.
Definitely use X-ray.
Yeah, exactly. Yeah, those security check, yeah, you definitely can using X-ray, right? So these, bone structures detection, definitely we can using X-ray, right? COVID detection, we can using X-ray or maybe CTs to detect those if there's any abnormal patterns for your lung, right? So actually the second, the first project programming assignment is actually using X-ray images to detect or classify COVID positive and negative case. So you'll find that very interesting. Okay, so here I list exactly like the TSA, for the security scanning, right? So if you go through the airport, right, you have to put your luggage, right, go through that X-ray machine, to screen if you have some potential prohibited, items in your luggage. Okay, so actually there's a data set was collected for this purpose, was actually published in CVPR 2019. So this is the security inspection X-ray benchmark. So they have, I think here, like 7 prohibited items. You can develop a deep learning algorithm based on the images and trying to detect and locate these prohibited items. Okay, so yeah, if you're interested, maybe you can also take a look at it at this particular data set. I think this is very interesting. Okay, so now the next is the ultrasound imaging. So before I talk about the ultrasound imaging, so maybe I have a quick question here. So do you know what's the sound frequency or the range a human ear can detect? So what's the frequency range human ear can detect?
From like 20 hertz to like 20,000 hertz.
Yes. Yeah, so 20 hertz to 20 kHz. Okay, so that's the range human ear can detect. So beyond 20 kHz or below 20 hertz, we are not able to hear those sound. And this ultrasound is defined as any sound wave that is above 20 kilohertz. Okay. So here's some of the early exploration of the ultrasound. So in 1794, Lazaro, I'll try my best to pronounce this name, was the physiologist first to study the US physics, ultrasound physics, by deducing bats used to navigate by echolocation, right? So we all know the bat will, send those ultrasound waves. It will help them to, kind of locate, and when they are flying through or navigate through the dark. In 1826, Jing used church bell on the water to calculate the speed of sound through water and prove sound travel faster through water than air. In 1880, Perry and Yaki discovered these piezoelectric effect. So these are some of the early exploration in this area. And also later in the 90s, this ultrasound imaging technology has been used for Medicare, right? In 1942, Carl Dusik, this neurologist, is the first physician to use ultrasound imaging for medical diagnosis. Okay, in 1948, George first described the use of ultrasound to diagnose gallstone, right? So that is stone, residing in your gallbladder, right? We also have kidney stone, which can also be using ultrasound imaging to detect kidney stones. In 1958, Ian Donald, who is the pioneer in using the ultrasound imaging in OBGYN, right? So you can using ultrasound to view the fetus in the uterus, okay? Okay, so here on the left, actually is a drawing show this kind of ultrasound imaging system, right? Oftentimes you will see this physician will using, have this, this is called a transducer, like moving around your belly area, if you are going for this OB check, right? So you are moving around this pregnant woman's, belly regions, trying to see, different angles of this fetus. Okay, so this ultrasound wave are produced by this transducer, right? So it can, both emit this ultrasound wave. It also can detect the ultrasound echo, reflect back, right? So, so that's why you'll see, using algorithm to reconstruct the image. Okay, so this transducer will send out a beam of sound wave into the body. Okay, and the sound wave will reflect back to the transducer. So when these echoes hit the transducer, they generate electrical signals that is sent to the ultrasound scanner. And using the speed of the sound and the time of each echo's return, the scanner can calculate the distance from the transducer to the tissue boundaries, okay? And these distances are then used to generate two-dimensional images of tissues and organs, okay? So dense, tissues will appear bright on this ultrasound, okay? For example, like you have like kidney stones or gallstones, which is high density, which will appear very bright on the ultrasound image, okay? Okay, so, right, so as I mentioned, there's a couple of features of ultrasound imaging, right? So for the resolution, for the deep regions, it will have low resolution and low SNR, signal noise ratio, and it is able to imaging soft tissues, okay? And usually, ultrasound imaging is real time, right? So if you, for example, for the OBs, right? So those transducer moving around, you can immediately see the reconstruct image on the screen, what it look like, okay? So here, this is the, ultrasound image example for this normal gallbladder, okay? And for this one is actually able to detect this gallstone here, okay? Which is show this very bright region because of the high density of the stone. And another clinical use case is the fetal ultrasound or the sonogram, right? Is using sound wave to produce images for fetus in the uterus. Okay, yeah, I have 2 kids, so every time I was with my wife when before the baby was born, we have this routine checkup, right? So I see how the technology is evolved. Right? My first child was born in 2012. I remember at that time, we don't have this 3D reconstruction yet. So this is actually like 3D reconstruction. So we can only see this. And my second one was born 2015. And I clearly remember, the ultrasound image is very clear, crisp. And also they provide these kind of color 3D reconstruction of the fetus in the very early stage. Okay, so for this ultrasound image, you can see how the fetus is developing over the time, right? You can see measure their size, maybe the arm length or leg length, right? So all these things, the doctor is able to kind of evaluate or measure based on the ultrasound image. Yeah, here is an example, right? So based on the ultrasound image, you are able to kind of calculate the bone fat and some of the physical, length measurement for this unborn babies. The ultrasound is also, can be used in renal artery. So the renal artery ultrasound is a test to check for problems in the renal arteries. So the blood vessels that supply your kidneys. And this provides detailed pictures of these blood vessels to help determine the extent and the cause of the restricted blood flow caused by renal artery narrowing. So on the right side, this figure, you can see this, the red and blue color indicating different directions of the blood flow in the vessels. Okay, and the color intensity actually indicating the speed of the flow. Okay, so based on this ultrasound image, you can actually identify, okay, which maybe part of the vessel, blood vessel, may be clogged, right? You have narrowing renal artery, which will cause restrict blood flow. Okay, so you can examine this based on this ultrasound image. And there's also a study was conducted in University of Michigan. Hello?
Yeah, we got you.
Christian, you're audible.
Yeah, so I think my internet was disconnected. So do you guys still see my screen, or it is kind of closed?
No, it's
Okay.
closed.
Okay. Yeah, let me reshare. It's still recording.
Yeah, when you
We can see
rejoin
it
the
now.
meeting, it resumed recording.
Okay. Okay. So where was I? Sorry about that. So did I, kind of?
You were here.
I was here, right?
Yeah.
Okay. So did I talk about this image already?
A little
Yeah,
bit.
yeah.
Okay.
a little bit.
Yeah, so basically I was saying, so for this particular image showing on the right, so this red, you see these red and blue color, right? So they basically indicating different two directions of the, blood flow. And you also see different color intensities, right? That indicating the speed of the blood flow. Okay, so based on that, you can examine, right, where there's some restrict blood flow, right? Maybe caused by the renal artery narrowing. Okay, so by examining this ultrasound image. Okay. And a recent study, conducted in University of Michigan, they were using a very short and high intensity pulse of the ultrasound to kind of cause the clot breakdown in the blood vessel. So on the left side, you will see that, right? So this blood vessel, you can see that, right? This blood flow is very narrow, right? So these white boundaries is the vein or the blood vessel, okay? So you can see there's some, clog here, right? So that's why your blood flow is very restricted, right? And they are using this kind of technique, right? Using a short high intensity pulse, after like 5 minutes, and these clot is kind of resolved, right? You can see the blood flow, returns to normal, right? So they did this study on pigs, and they are hoping maybe this eventually someday, if this technology is mature enough, can be used, on the human. Okay, so there are a lot of benefits of ultrasound imaging. So the first one is the most ultrasound scanning is non-invasive, right? So you're just using the transducer, put that on your body skin, right? There's no needles or injections. And ultrasound is widely available and easy to use, and less expensive than other imaging method. And ultrasound imaging is extremely safe and does not use radiation. And also it can give a clear picture of soft tissues may not show up well on X-ray images. Okay, and typically ultrasound is a preferred imaging modality for diagnosis and monitoring pregnant women and their unborn babies because of these, there's no like safety issue, right? So it's able to, safe for the pregnant woman and their unborn babies. And ultrasound is able to provide real-time imaging, right? So this makes it a good tool for guiding minimal invasive procedures such as needle biopsies and fluid aspiration. But there's maybe a potential risk, right? So the ultrasound energy has the potential to produce biological effects on the body, right? And also the ultrasound wave can heat the tissue slightly. Okay, so, but I think this is very minor or may not apply to everyone. So that's why, generally ultrasound imaging are considered very safe. Okay. Okay, so the next modality is computed tomography, okay, CT. So basically CT also using X-ray. So the difference between CT and X-ray is is 2D image, right? You make a scan and you generate image. But for the CT, you actually will generate a 3D volume, okay? So basically it uses a combination of X-rays and computer technologies to produce like horizontal or axial images, often called a slice of the body. And to achieve that, a narrow beam of X-ray is aimed at a patient and quickly rotate around the body. Okay, so you'll see on the figure, right? If you go to this CT scanner, like a donut, right? So like a circle here, then you go through this CT scanning machine, right? So the outer like X-ray source will actually rotate, right? And make a lot of scans at different angles. Okay, so each scan will call a slice of the body. Okay, so these slices are called this tomography images and contain more detailed information than the conventional X-ray, right? Basically, it'll give you like a 3D representation of your human body, right? So if you look at the bottom, right? So this is like a brain CT volume or CT scans. You have so you have a lot of scans, right, at different slices of the human brain. Okay. And also here, I want to mention a little bit about this CT contrast agent. This when you take a CT scan, you may not take this contrast, but sometimes you do, the radiologist may require you take some contrast agent, okay? So for the X-ray, like those, dense structure like bones are easily imaged, right? Because they absorb the X-rays and show the bright region on the X-ray. But the soft tissues vary their ability to stop X-rays and may be difficult to see on the X-ray scans, okay? So these IV contrast agent have been developed, that are highly visible in X-ray or CT scan, are safe to use in patient, right? So you usually, you will have some like IV injection. So make your, particular, tissues or organs, highly visible on the X-ray. For example, if you are taking or drink those kind of contrast, maybe your stomach, regions will be more illuminated, right? Like showing very bright on the image scan because of these contrast. And also if these IV contrast is injected, through the blood vessel, maybe your blood vessel will be able to, highlight it on the X-ray. Okay, so these are very helpful to kind of help the radiologist to make very accurate diagnosis. And these are some of the CT imaging devices, right? So you have these like arm shaped, right? So you go through these like arm, like you find this like industrial assembly line, right? Those robotic arms. So you can, this is one type of imaging device. And here, this on the right, this mostly will see this type of CT scanners, right? You lay on this table and or slider, right? It will, slowly move the human body into this scanner, okay, to make a lot of, scans of your body. And also we have this micro CT. Okay, so because of these CT scanner will take different sections of the body, right? So in nature, the CT image is in 3D, right? So here we have different views for this CT image. Okay, so we have this axial view, we have this sagittal view, and also have this coronal view. So which I'll explain these three views. Okay, so for the sagittal view, so you can kind of imagine, right? This human body was like a separate, generate the slice on the view of left and right, right? You see from this direction. And for the coronal view, right? So you basically separate like from front and the back. Okay, for this axial view, basically like from top to bottom. Okay, so this is, if you're looking at a person on the side, right? So this is how a human body, and this is like how you, view this internal of a human body from the front, right? Like a frontal view, and this is the axial view of the human body. Okay, so yeah, this figure also shows, right, different views or planes, coronal plane, sagittal plane, and axial plane. Okay. And there's also some specific terminology, when we in this anatomical space, right? We have right, left, and maybe on the front and back we don't say this, but we actually say anterior and the posterior. And also top bottom, we don't say that, we say inferior and superior. Okay, which I'll explain this in the next lecture when we're actually using imaging software like INK Snap to visualize some of the CT or MR scan. So they have these kind of terminologies to in the anatomical space to indicating the direction. Okay. So yeah, we have a question here. Yeah, so basically, your body will absorb, right, some of the radiations, right, from X-ray and or CT scanners, right? So the detector will measure like how much energy is going to be left, is going to be received or detected by those detectors. Okay. So for this, CT scan, these 3D volumes, right? We have these multiple scans, right? This is the exo view, right? This is the sagittal view, this coronal view, and this is the sagittal view, which you can see multiple slices. And here, because the nature of a 3D, right? So we use XYZ, to locate a specific pixel location. And there here are a couple of imaging CT imaging examples, right? We can using CT images to diagnose tumor. Okay, so here I provide an image for the liver tumor segmentation, right? So these red color indicating the normal liver region, and this green indicating the tumor region. And we can also using CT images to diagnose some of the disease for the lung, right? So image A here shows in the normal of your lung, and B shows the emphysema, which is a condition, the air sacs of the lung are damaged and enlarged, cause some breathlessness. Okay. And also on the third case, image C, we have this ground glass opacity, right? So this refers to the hazy gray area of the lung. And so when the lung tissue, this will indicating this increased density inside the lung, right? So here, like, for if you see this COVID patient, their CT scan of their lung, you will see this kind of present some of the ground glass opacity. Okay. And D here is this fibrosis, disease of the lung. So it is a disease that occurs when the lung tissue becomes damaged or scared. So the thickened stiff tissue will make it more difficult for your lungs to work properly. Okay. And on the image E here, we'll see these micro nodules. Okay, so basically these are like small dense regions. So this shows indicating some abnormal growth that forms in a lung. But in most cases, these micronodules are considered like non-cancerous, okay? But sometimes it will leading to a tumor or cancer, okay? But I'm not the radiologist, but this is just some of the knowledge I know for this particular disease, okay? So the last one is called the consolidation. So it occurs when the air that usually fills the small airway in your lungs is replaced with something else, right? Maybe a fluid or maybe blood or water, okay? So consolidation must, if you diagnose this like pneumonia, so this consolidation is kind of like a phenomenon, before you diagnose this like the pneumonia, okay?
I have a question.
Yeah.
So this is an axial view, correct?
Yes.
So I'm a little confused on A. So the black area is the region of the lungs where airflow would be. Why is there a connection at the top? Like, I don't usually imagine air going from one lung to the other.
You
So
mean here? This one?
Yeah, right there.
This region?
Yeah, what? Yeah.
Yeah, so I think this may depending on, so for some of the light tissue, right? So remember we mentioned like some of the high density tissue will show as a white region, but maybe, but I do see there's a slight white here, right? I don't know if you can see that, right? Kind of separate this left and right. But yeah, I mean, this is not like the same cross section, the same position, but this may be taken from a different, remember we have multiple slices, right? Maybe this is a position that imaging in this way, but this one maybe, have a different position of different slice, right? So maybe you see a large separating region here.
Okay, okay. Yeah, I do see that tiny little slit now.
Yeah,
So
so
maybe it's
there's
just
like,
the two lungs
yeah.
touching.
Yeah.
Okay, that makes sense. Thanks.
Okay. So yeah, I think that's all for it today. So for the next class, we'll talk about MRI, PET, those kind of functional, for some functional analysis, and also talk about some of the typical applications, using these different imaging modalities, maybe for, tumor segmentation, anomaly detection or localization, or maybe just for classification purpose. Okay. So a couple of reference, you can, if you're interested, you can look at these, some of the basic introduction from Michael Lusting from UC Berkeley. So they have provided a lot of background knowledge. Some of the, I also use that in this lecture. Also, you can go through this kind of textbook. And by the way, for the next class, we'll also talk, kind of give you a very basic usage of the imaging software, ITK Snap. Give you a couple of examples, like show the CTs and visualize different slice of the scans from different views, right? Those 3 different views, and see how those different slice is able to kind of imaging different parts of the body, right? So yeah, so that's for the next class. Okay, so before we end here, any questions?
Hello, Dr. Chen. I have one question. So,
Yeah.
how important? How important is this book, like fundamental of imaging, medical imaging? Like, is it for computer science guys or?
You mean? Can you repeat your question? You mean the background
Textbook?
knowledge?
I mean, the textbook for the course that you are referring to, is it like
Yeah.
super
So
helpful?
you mean the textbook? This one?
Yeah.
Yeah. So yeah, it's not very important for this course because, like I mentioned in the beginning, right? This course is not training you to be a radiologist, right? Like understand, like what's going on, like based on the images, those imaging scans, you can able to make a diagnosis or make some treatment. This is not, we are not trained for the radiologist for this course. So for this textbook, if you're interested to see, like you want to understand the details of how like X-ray machine, understand the physics, right? Like X-ray, CT, or later MRI or PET scanner, how those machine is, what's the working principle or mechanism, understand the physics. Maybe you can referring to this textbook or other materials. But yeah, for as far I'm concerned, the lecture, I will give you all the basic knowledge you need to maybe reading papers for you to conducting those course project or programming assignment. Okay. Later, you will focus on the machine learning aspect and how images being processed, right, using different deep learning technique. So that's the main focus. Okay. Does that answer your question?
Yes, Dr. Chen. Yeah.
Yeah. Okay. Okay. All right. Any other questions? Yeah, I mean, if you do have some questions like regarding different modalities, right? You want to know more, like what's really going on. So one quick source is you can Google it, right? So you can find a lot of resources and maybe a research papers like describing some of the underlying mechanism or physics of that imaging modality. And some typical challenges or maybe some of the applications can be used for that particular medical imaging modality. So that's the quick way for you to find some background knowledge, if you would. Okay. Okay, all right. Thank you guys. Yeah, sorry for the interruption during the middle of the course, but so this might happen due to we are doing this online, but yeah, thank you for staying online. So if it happens in the future, I'll try to come back online as soon as possible. Okay. All right. Thank you, everyone. I'll see you on Thursday. All right. Bye.